and welcome to this webinar. We are delighted to have Dr. Mathilde Barbeau with us today. Dr. Mathilde Barbeau is originally from the South Shore of Quebec City, where she grew up. After completing a bachelor's degree in psychology at Université Laval, she went on to complete her doctorate in family medicine at Université de Montréal. She returned to work in Lévis in 2001. She first worked in a CHSLD and then in a Physical Disability Rehabilitation Center, then joined a family medicine group, FMG, where she still practices as a family physician. She is also a physician evaluator at Retraite Québec. In her spare time, she enjoys walking outdoors with her friends and adapted downhill skiing, also called biskiing. So now to you, Dr. Barbeau. So we will start. I have no conflicts of interest to declare. So today we will be reviewing some healthy habits we should be having. We will also look at screening of high blood pressure, cholesterol, obesity, and diabetes. We will talk a little bit about screening of TSIs, sexually transmitted, and bloodborne infections. We will talk a bit about screening of certain types of cancers. We will also talk about neurogenic bladder and also a urologic follow-up for women with Spina-bifida. We'll talk a little bit about a pregnancy follow-up and folic acid and how we can prevent osteoporosis. We will start with good health habits. Eating well is something that's recommended. Now we recommend to eat a lot of fresh fruits and vegetables. We used to talk about 5 portions a day, but now we took this away and we talk about eating as much as possible of fruits and vegetables, as much as we want. We also want to favor whole grains food. It can be quinoa, oat, whole wheat bread, or whole grain bread. And to also eat protein at each meal. It can be legumes, peanut butter, eggs, milk, tofu, fish, or poultry. As far as physical exercise is concerned, we recommend to integrate each week about 150 minutes a week that we can split up in 30 minutes a day, 5 days a week. But of course, if people feel, oh, this is really a lot for me, I don't do a lot of physical activity right now or not at all, it's nice to start with 10 minutes once or twice a week, and then we see how we tolerate it and how we feel when we go outside. If it's in the winter and it's a little bit more difficult, we can even take our wheelchair and go to if we are in a wheelchair, and go to a shopping center. There were walking clubs during but with the pandemic they've come to a halt. But you can go by yourself, or sometimes when we go with friends, it's motivating and it encourages us to move when we are in company of friends. So you can start 10 minutes once or twice a week, and we see things are going well. So the week after, we can go 15 minutes 2-3 times a week until we get to do a longer physical activity. Of course, if we go over 30 minutes, it's not a problem at all. If you do cross-country or downhill skiing or skating or swimming, then if you go for an hour, that's great. Let's continue. Of course, tobacco and drugs are not recommended. As far as tobacco, there's no minimum or amount of cigarettes that's safe to smoke each day, because it can lead to lung cancers or throat cancer, or even bladder cancer. That's a little less frequent. As far as drugs, be they soft or hard, I don't recommend them. And if someone feels maybe they have problems with drugs, or they want to stop smoking, Then there are pharmacists who are specialists in stop in helping with stopping to smoke, and there are also readaptation centers on addiction that can help you if you have any problems with that, or you can talk to your nurse or practitioner. As far as alcohol is concerned, what is recommended for a woman is to have a maximum of 10 unities a week and a maximum of 2 a day. Occasionally we can have 4 or 5 during one day, but that's not recommended on a regular basis. What does 1 unit of alcohol mean? If we have really large wine glasses and we fill them up, then it's definitely more than 1 unit. As far as 1 unit of wine, it's half a cup or 140 milliliters of wine. For a beer, we talk about a small can. It's about 340 milliliters and 1.5 ounce of stronger alcohol. Now we will talk about the screening of diseases that may present some risk for the heart. This is quite medical, what I'm going to talk to you about now. Some aspects will be a little bit heavier, perhaps, and maybe less interesting for you. And please do not hesitate at the end. If ever you have any questions and you want me to clarify something, let me know. As far as the screening of diabetes, we now do it with defined risk form. This is what it looks like. Your nurse practitioner or your MD can help you and may have some forms at their office. And you can also actually download it on the internet and get it there. There are several questions on the form. It starts with the age. Does the person eat fresh fruits and vegetables? And according to the score you get, then recommendations as far as screening are given. If a woman has a very high score and is very high risk, then we recommend to do screening once a year. Also, women who have done who have had gestational diabetes, meaning during pregnancy, or if they have high blood pressure, or if they are of indigenous origin, then they should be doing screening and doing a test every year. So women who have a more moderate or low risk, but who are more than 40 years old, we recommend then screening every 3 and 5 years, or 3 to 5 years. And all the adults who are who have a high risk, who are at high risk, whatever the age, we recommend the screening be done every between 3 and 5 years.
So now let's talk about screening with cholesterol, which we call dyslipidemia. It is recommended in adults between the age of 40 to 75 years old every 5 years. Sometimes we do it at the same time as the screening for diabetes. And this screening is not for people that for who we know have cardiovascular issues, who have already had illnesses or amputations related to this, for artery blockages, for example. For these people, they should already be following a treatment, so we don't have screening. Screening is for people between 40 to 75 years old who have not had issues. If a woman is under the age of 40 but has risk factors for cardiovascular diseases, we can do a screening before the age of 40. These are examples of risk factors. AF means family history of high cholesterol, high family history of heart disease. For example, if your mother had angina or other heart issues before the age of 65, and the father before the age of 55. If the person has hypertension, kidney failure, if the woman had her menopause before the age of 40, so precocious menopause, if they are a smoker, if they have diabetes, if they have abdominal obesity with a waist circumference above 80 centimeters, it might be useful to do the screening before the age of 40. Now for the screening of high blood pressure or hypertension. So these are synonyms. It's for all adults over the age of 18. And today I'm not talking about screening for children and teens, because there are different recommendations for these populations. So we're talking here about adult women who have spina-bifida or hydrocephalus. So screening for this every year when you visit your family doctor or nurse practitioner. If a woman with spina-bifida or hydrocephalus that has dilated kidney, you see that sometimes with neurogenic bladders. So it's important to do this screening for high blood pressure. So remember to ask your doctor when you see them, but you can also do it at the pharmacy. They have tensiometers, machines that measure this. During the pandemic, a lot of pharmacies did not offer this service, but they should start doing again. So please ask when you go to a pharmacy if you don't have a tensiometer at home. If you are close to hypertension, it might be useful to go see a clinic. And if the indicator is in the red, you should really go without waiting. So what are the normal blood pressure values for an adult? If you have a home blood pressure monitor, the tensiometer, you have to measure it on your arm, not on your wrist. And the normal value is 135 over 85 at a minimum. If you are in the pharmacy, same thing. If you're at the office of an MD and they have a stethoscope on them, it would have to be 140 over 90. However, if it's measured with an oscillometric tensiometer in series, it would be the normal one would be under 135 over 85. You don't do a diagnosis with only one reading. You have to do more than one reading to have this diagnosis of hypertension. And measuring it at home with a tensiometer, you have to do it morning and night for 1 week. That is as valuable as doing 5 with an oscillometric tensiometer in series in a clinic. So if you've measured it at home, you write it down and you bring it when you go visit your doctor. Now, a word on the screening of sexually transmitted infections and bloodborne infections. So here's a list that is non-exhaustive. So there's other ways to screen. Someone can go for their screening even if they don't have any of these factors going on. We will never refuse a person. So a person who is sexually active over the age of 18 can ask for one. If they have a new partner before having sex with them, the both should do the test. If you've never had sex, there you don't need to do it, but if you have a new partner and you've previously had unprotected sexual encounters with one or more partners, you should do this screenings for STIs. So pregnant women, even if they're in a monogamous relationship, at the beginning of the pregnancy, it's a useful thing to do. Injection or intranasal drug users, even if they've only done it once, it is a recognized risk factor, so don't hesitate to ask for a screening. People who have piercings or tattoos that were done with non-sterile material should be screened. People who've received a blood or other blood product transfusions can also ask for a screening. Some may have received even a letter from the government inviting them to go for a screening if they had a transfusion between a certain year and another year. And don't hesitate to ask your doctor ever if you think you may be at risk. Some STIs like HIV, syphilis, hepatitis C will be tested with a blood test, and other like gonorrhea, chlamydia will be with a urine test or on the cervix for women. And we can do it at the same time as the gynecological cytology. So don't hesitate to ask for the screening if you want one. Now let's talk about the screening of some cancers. Not all cancers can be screened. These are the 4 types of screenings that are available in Quebec for women. So there's cervical cancer, breast cancer, colorectal cancer, of the large intestines and rectum, so the piece that is right above the anus, and lung cancer that we started screening recently. So when we talk about cancer screening, it's done in asymptomatic adults or no symptoms of concern. For example, someone who's coughing up blood, it wouldn't be just a screening. So it's never mandatory, and there are advantages and disadvantages to doing a screening, as we will see. But quickly, the advantages of screening a cancer early would be that maybe we'll find the cancer when it is smaller, treatable, um, easy to operate, and we can increase the chances of survival of this person. The disadvantages is to save lives, a lot of lives. There will be a lot of screening, so it can be stressful, a lot of waiting. There's more tests to do if the first one is abnormal. So for cervical cancer screening, it's offered to any woman in Quebec who's aged between 21 and 65 who is sexually active or who have been sexually active in the past. It's done every 2 to 3 years with a pap test or a gynecological cytology. It's done on the uterine cervix. However, if the woman has ever had an abnormal result, maybe their doctor will ask them to do it every 6 months or every year for a certain period of time. A word on vaccination. The vaccine against HPV, so human papillomavirus, that is a risk for uterine cancer, is available. So this virus can be caught during sexual relationships, and you may not know that you're a carrier. So getting vaccinated reduces the risks of very much of developing this cancer and condylomas as well. So there are a couple of different vaccines for this available in Quebec. It's part of the Quebec vaccination program. It will be free soon for people under the age of 18, for others under the age of 26, but it can be offered to women up to the age of 45. But in this case, it won't be free. The woman will have to pay to receive the vaccine. There are some doctors that even offer it over the age of 45. It can be interesting for women who was with the same partner for a long time, but there's a separation and they have a new partner. There's more risk of getting HPV. So don't hesitate to discuss this with your doctor. There are also nurses who are very good at vaccination in GMFs or CLSCs. Don't hesitate to ask some questions. Now, a word on breast cancer screening. The Quebec program on breast cancer screening is offered to all women aged between 50 and 69 years of age. They will receive a letter from the government inviting them to do a mammogram every 2 years. You can also do it for women aged between 70 and 74 every 2 years, but here you would need a medical prescription. Know that so it's an examined radiology that you need to do an appointment for. Take an appointment. So you receive the letter, you call where there are mammograms, they take an appointment. However, if there are incidences as of breast cancer in the family, you should talk to your doctor because there is a possibility of early screening relating to the age of the youngest case that there was in your family. And if there are symptoms such as a lump on the breast, if there is a discharge or bleeding on the nipple or near it, that is not going away, that it lasts a certain time, we won't just do screening. There is something abnormal going on. So do not hesitate to talk about it with your healthcare provider. Don't wait for the government letter. Talk about it. And so the doctor can prescribe a mammogram after examining you.
Qu'est-ce que ça donne, dans le fond, le dépistage du cancer du sein? Pourquoi
So why do we do the screening of breast cancer? What studies have shown is that it reduces the risk of going through chemotherapy if we discover a cancer, because sooner, because if we detect it soon, then it's at a less advanced stage and it reduces the risk of dying as well. And we saw that out of 1,000 women who were screened, 7 breast cancer deaths would be prevented. But there are some inconvenience in screening, stress when we're waiting for the results. Also, we have false positives. These are mammograms that are not normal, but we don't find any cancer there. So this is close to 300 out of 1,000 cases that are screened. Biopsy, what is a biopsy? Is we take a sample. Generally, if a mammogram is not normal, the radiologist will want to find some extended tissues, and we'll see if there are some lesions that might orient towards breast cancer. So there might be a recommendation to take a sample within the breast to analyze it and see if it's cancer or not. So this is what a biopsy is, and it's taking a sample. And we've seen that 37 out of 1,000 biopsies are, well, we write not useful, but I write not useful, but it's not really not useful, because if there is one, well, good thing we found it, right? And another inconvenient is over diagnosis. Some women who might have one but would never develop it um, or die because of it. A word on screening of colorectal cancer. It's colon and rectum cancer. It's recommended for adults between age of 50 to 74. How do we do this? We do this with what we call a fit test, where we search for occult blood, that means invisible blood in the stool. So we indicate and recommend this every 2 years. And if someone doesn't have any symptoms, but if you have neurogenic problems, you can, if you have a neurogenic bladder, you can have a screening. But if there's some change, blood in the stool, change in the frequency of stools with regards to what used to be before and our prior habits. So if stool are really, really very, very thin, like pen, then it's not screening. It's something serious, and we need to ask to see the MD, and then he or they can do an exam. So for someone who has no symptom, we're looking for occult blood. If the test comes out positive, meaning they do find very small amounts of blood in stool, then they will refer the person to a colonoscopy. What is this? Is we put a small camera in the large intestine and colon. A small note here: if there is family history of colorectal cancer or polyposis, family polyposis, or there have been polyps in the large intestine, then tissues can be different, and the gastroenterologist or the MD can recommend that the next colonoscopy will be in 3 or 5 years. So they will recommend with regards to the first case of colorectal cancer in the family. What are the advantages of screening as someone who has no symptoms? We increase the chances that if there is cancer, we find it at a very, very early stage. And this way, it's much more easier to treat it. And someone who does a fit test, we see that we could actually prevent 5 deaths uh, out of 1,000 people screened. As far as the screening of the lung cancer, this is being organized all over Quebec. It's indicated for adults from age 55 to 74 who smoke or stop smoking since less than 15 years. And this person needs to have smoked for at least 20 years What does that mean to have smoked for 20 years? Actually, we calculate all the years that the person was smoking, and we remove the person's the periods where the person stopped smoking, if that happened. That doesn't mean it's not dangerous anymore to smoke. As I was saying earlier, no quantity of cigarettes is harmless, and any person, each cigarette can be harmful. And unfortunately, cancer, lung cancer is very lethal, and a lot of people die from it. And with the screening, we want to detect the cancer when it's small and treatable in very early stage. How do we do this? We do this with the low dose CT scan, and can be prescribed by a doctor or specialized nurse. So if ever you smoke, don't hesitate to talk about it when you meet your MD. And as far as patches are concerned, if people want to try to stop smoking, I encourage it, of course. So they can help you decide, evaluate if if you see how they see how many cigarettes you smoke every day. So before, we've done some screening, and we could see that out of 1,000 people who were screened, 52 cases were found. And out of the 26, actually 26 were found early enough that we could heal and operate. And we could also avoid or prevent 8 deaths. We will talk about neurogenic bladder. It's a very frequent uh, condition for women with spina bifida. A little bit of recall here. It's important to do a follow-up, urological follow-up to preserve health of kidneys and bladder. Sometimes I see people who went for 10, 15 years without doing follow-ups of their bladder or urologic follow-up, and I find it's too bad, because even if you feel everything is going well, it's better to do a follow-up. And how do we do this follow-up? We do it with the urologist, of course, but also with blood tests to check the how the kidneys are working. The urological follow-up is recommended minimally every 3 years with an ultrasound of the kidneys. It can be prescribed by the nurse practitioner or the MD. Maybe the urologist is going to say, I prefer seeing you every year. Or if the person has had a Botox injection in the bladder, then follow-up can be done every few months. Uh, Most of you have probably done these tests and these follow-up. The follow-up, urological follow-up can comprise urodynamic assessment. We look if the person can empty their bladder by themselves. If not, we can see how we can help to the person to empty the bladder. Also, the urodynamic assessment can include cystoscopy. This is a camera in the bladder. So it allows to go and see what is happening inside the bladder. And as I was saying earlier, the ultrasound of the kidneys and the bladder, what we call the urinary tree. When the bladder does not empty naturally or spontaneously, then we could do bladder catheterizations. patients, most women who have a neurogenic bladder who need bladder catheterization can do it themselves. If it's difficult, then it can be installed. Sometimes with kids, with kids, parents are going to do it. If ever there are urinary leakage because of uninhibited contractions, if the bladder, while it's filling up, sometimes it contracts and there are leakage. There are solutions for this. We can use medication that calm the bladder. There's the Detrol, le Mitoril. There are different medications, and other companies produce them as well. If you have side effects, sometimes it can constipate or bring dryness in the mouth. So dryness in the mouth, constipation. If this is your case, don't hesitate to talk about it with the person who prescribed it, because you might find alternatives with less side effects. If we don't use medication, we can also do intravesical Botox injection done by the urologist. And the women can use protections, but the first two options are more interesting, and most of the time it gives good results. If a woman, of course, we see there are a lot of urinary infections among women or for women who have neurogenic bladder. If a woman has a urinary infection, is it dangerous to transmit it to their partner during the sexual relation? No. Actually, the sexual relation is a risk factor to develop a urinary infection, but this is not how it is transmitted. And if this person, maybe you've heard about this, you might have heard of bacterias, symptomatic bacterias. They're present in the bladder, but there is no infection. Then we don't need to use antibiotics. In this case, is it dangerous to transmit it to our partner? No. So we don't worry about it.
If you are at risk of having UTIs, how can you minimize the risks? After having sex, a few tips. It would be to urinate after sex, staying well hydrated after sex, not too much before if you want to minimize the risk of leakage. So if you hydrate well and urinate a few hours later, that's fine. But if you have urine leakage, you should avoid drinking 2 hours before sex to decrease the risk of leakage. It's possible also of taking an antibiotic within an hour before sex. You'll say, well, that decreases spontaneity. Of course, you're right. It's not always possible to plan this. If ever you have this prescribed antibiotic and didn't take it before, you can take it right after. There's a new product called Utis, 2 tablets of 36 milligrams. What's recommended is 2 tablets right before or right after sex. If you have sex many times in a day, you only take it twice in a day. It's 2 max per day, and then you can take 2 the next day. Unfortunately, RAMQ does not cover Utiva. If you have private insurance and you have a prescription, you can check if your insurance covers it. It's not the case for all insurance plans. A few words now on pregnancy and Spina-bifida. Spina bifida does not affect the fertility of the affected women generally, or a woman with hydrocephalus. So the woman who has spina bifida, uh, if they have unprotected sex with a fertile man, they can get pregnant. So if she does not want to get pregnant, she needs to use contraception. So it can be a condom, the pill, or ibuprofen injection. There are many types of contraceptions nowadays. It could be interesting to talk about this with your doctor to see what is best for you. About oral contraceptives, the usual ones that contain estrogen and progesterone can increase the risk of thrombophlebitis in the leg, so a blood clot. If you don't feel your legs, if your legs don't move, you are more at risk of getting this. So if you take this type of birth control, maybe it would be best to use another kind. And about condoms, if you are allergic to latex, or if your partner is allergic to latex, choose a latex-free condom. They exist. 30 years ago, it was condoms that were made with natural lambskin. Now that's not what they are anymore. It's really a type of condom that are can prevent STIs that are made without latex. So read on the package if you're not sure, or ask the pharmacist if you have questions. So a reminder, if you take oral contraceptives or ibuprofen or other contraception that is not condoms, that does not prevent bloodborne STIs. You really need to add a barrier method such as a condom, no matter the age of the person. If you are planning a pregnancy, I encourage you to discuss this with your doctor, your urologist maybe. Sometimes there are references in care clinics, which means high risk pregnancies. It's not to discourage women with spina bifida to have children. Quite the contrary, there are many beautiful examples of women who had children. Often when the referral is done, when the woman is trying to get pregnant or is pregnant, you can go see a doctor. There are many in Saint-Justine, Chaudière-Appalaches. I don't know all the hospitals in Quebec. I'm sure there are some elsewhere in Sherbrooke, for example. So there will be a meeting before the woman is pregnant and then after she is pregnant for women with spina bifida to reduce risks of having a child who also has a spina bifida or hydrocephalus. It is recommended to take 5 milligrams of folic acid per day and to start doing this at least 3 months before you get pregnant. So this means, for example, a woman who has a diaphragm, as she uses that as birth control. So this is inside the uterus. So before getting it removed, she should start taking folic acid 3 months before. So IUD, before removing the IUD, and then she continues taking folic acid during conception and while she's pregnant, because the neural tube, so bifida is an anomaly of the neural tube on the fetus. This is formed we used to say in the first 3 weeks of pregnancy. Now we say in the first 28 days of pregnancy. So sometimes before the woman even knows she is pregnant. So you have to start taking this at least 3 months before you get pregnant. So we'll end with this screening of osteoporosis, an illness that is often more prevalent with older women. So the screening is recommended for adults over the age of 50 with a bone densitometry test. You don't have to do it every year. The doctor does a survey to see if it's worth it at your age to do it, because you can wait until the age of 60 if there are no risk factors or family history. So people who don't walk, if they use a wheelchair, you have osteoporosis from non-use. It can start from the teen years. So the bone density won't be as dense because you don't use it. So people who walk, the treatment for them is different. I won't go into detail, but the prevention is the same for everyone. This is a standard approach to prevention. So for adults, and particularly for women, we recommend taking 1,000 units per day of vitamin D. So you can buy it anywhere or get a prescription as well. For children, it's less. Don't give this much to children. You have to eat dairy for calcium, 2 or 3 portions per day are recommended. If you don't eat that, you have to take templates. You have to do physical activity with weight bearing on the feet if possible. So you can walk, snowshoe, ski, and you'll say, well, what if I swim or bike? So it won't necessarily prevent osteoporosis, but of course, it's always useful to do a physical activity. It's great for your heart. So of course, that is recommended as well. But to prevent osteoporosis, you have to do physical activity with weight bearing on the feet. So recommended daily amount of calcium for women from the age of 19 to 50 is 1,000 milligrams a day. And if you are over 50, it's 1,200 milligrams a day. You'll say, well, that's complicated. How do I calculate how much I get? You can go on the Osteoporosis Canada website. I'll give you examples here with the help of Miss Isabelle Côté, who's a nutritionist. So 250 milliliters of milk or 1 cup, that's about 300 milligrams of calcium. Same for a cup of fortified soy beverage, so 300 milligrams. 1 yogurt of 100 grams. So be careful, sometimes a small yogurt is 75 grams, but the bigger ones are between 100 to 150 milligram. A piece of hard cheese, cheddar, for example, has 200 to 245 milligrams, so 50 grams of cheese has this much. Soft cheeses have a bit less calcium. Cottage cheese even less. However, if for you it's the only kind of cheese you like, cottage cheese, it's better than nothing. But if you like all types of cheese, you may want to increase your use of harder cheeses. So half a cup of almonds has 200 milligrams, one medium orange has 50 milligrams. Half a cup of cooked broccoli, 33 milligram. Sesame seeds has a lot of calcium, so 15 milliliters, that is just a tablespoon, has 94 milligrams. So thank you for your attention. Here are my references. Thanks again to Isabelle Côté, nutritionist at the University of Laval. A word about the American Association of Spina-bifida. There will be in 2023 a symposium at which I will participate. If there are updates on the research, I will be there for them.